Viewer contributions make local programming possible on WNIN. Become a member of WNIN with your contribution so we can continue to make this programming available. Visit WNIN.org and click on the donate button.
Flu season has been especially harsh this year. Add on COVID and norovirus numbers, and there's a lot of sick people out there. We'll talk to local health experts about infectious illnesses. That's next on WNIN Newsmakers. Now we'll talk to Ashley Libbert from the Vanderburgh County Health Department. Thank you for joining us.
You're welcome.
Now tell me about, does each county in Indiana have their own health department? How does that work?
Yeah, each county, there's 92 counties in the state of Indiana, and each county has their local health department.
And then I'm assuming you all kind of work together, sharing information and...
For sure.
And I was going to ask, is there one, like central one that you report to?
Well, all local health departments report to the Indiana Department of Health. We are really lucky down here in southern Indiana in District 10. All the public health departments, the nurses that work in the health department have a really great partnership, so we can help collaborate and bring to our communities what they need.
So what is your department in charge of?
Sure. So I operate within the communicable disease division at the Vanderburgh County Health Department. So that oversees our immunization clinic, our STI clinic, disease investigation, which includes case management of diseases such as tuberculosis and investigation of those diseases.
So just in case people don't remember in health class, what is a communicable disease?
Sure. A communicable disease is a disease that can be spread from person to person.
Contagious.
Contagious, correct.
So what about vaccinations? I know there's a lot of talk about that. I mean, can you speak on the importance or about vaccinations?
Yes, of course. So one of the primary roles in public health is prevention, and something that has made a huge impact on the prevention of disease is the invention of immunizations, vaccinations, to prevent different diseases. It can't prevent all diseases, but it does make an impact in the spread of those diseases and how those diseases can affect the morbidity and mortality of each individual.
But we have seen, historically, didn't it eliminate smallpox, for the most part, and polio and different things, but that came from having vaccinations, correct?
Correct. So we've seen a decrease in all vaccine preventable diseases because of vaccines and the social support systems in place to get those vaccines out to individuals. But as we move into some vaccine hesitancy, we have seen an increase in some of those vaccine preventable diseases again.
So what, for example, like which ones are you talking about?
So locally, we've seen an increase in cases of pertussis. Within the state, there has been a case of measles. One case of measles alone indicates an outbreak because it is so infectious.
And what is the concern about measles? I mean, is it going to kill someone, or can it? What is the concern about something like that?
For sure, measles is a virus, and we are really worried about our pediatric and our immunocompromised populations when it comes to that virus. So those individuals, such as diabetes, COPD, heart disease, are at higher risk of death from those infections.
Have we seen deaths from measles? In Indiana or around in the United States?
Not necessarily in Indiana, but there have been cases of, unfortunately, deaths due to measles.
So what happens if somebody is vaccinated, though, they're probably not going to get measles? Is that...
That is for the most part true.
Right.
Immunizations can prevent you from developing the disease, but it also can decrease the severity of the disease as well, because the vaccine's not going to stop you from being exposed to it if the disease or the virus is around. But if your body has already mounted an immune response to the immunization and you're exposed to it, then you're going to have a less severe case.
Well, what about, you're talking about how the numbers are down on people getting vaccinations, but isn't it still required for schools and things?
Yeah, so the state of Indiana still has required vaccines for the school systems, but individuals who are medically contraindicated from getting those vaccines, or they can look at getting a waiver.
Okay. So what do you consider to be the biggest areas of concerns right now insofar as communicable diseases?
For sure. Definitely the decrease in our pediatric vaccination rates. We work very closely with both hospital systems here in Vandenberg County, the local health departments in our district, and all of our providers to discuss ways that we can increase our vaccination rates while bringing the vaccines to individuals, looking at removing those barriers to vaccination.
What would you tell parents, let's say of an infant or whatever, of how can they make the best decision about their vaccinations? Aside from saying you need to go get your vaccination or get your kid vaccinated, what can you tell them as far as educating themselves as to how to make the best decision?
Sure. So we always recommend that they talk to their provider. We know that parents trust into their providers and the information that they're told, as they should. If they have questions or concerns, their provider can answer those questions for them, or they can always reach out to their local health departments. The nurses there are trained in immunizations and very well versed in answering those kind of questions.
Going back to measles again, I'm talking about if it was pretty much kind of wiped out from vaccinations, and where did it come from? How do we end up with these things again?
Sure. So viruses and certain diseases are always kind of in the population. It's making sure that we have a herd immunity from those immunizations. The immunizations prevents the spread of those different diseases. So if enough of our population is vaccinated, it prevents that spread within the community and kind of breaks that chain of infection.
Okay. So I didn't know if a lot of them came from maybe somebody's visiting another country and they come back in and bring some of the different illnesses.
Sure, there's always that possibility. Other countries sometimes lack in public health infrastructure and access to vaccination, and we are a very transient world. It's easy to hop on a plane and travel. So it's really important that when you're looking at traveling, that you're up to date on all of your vaccines.
Yeah, and are you still recommending that they get COVID vaccinations, especially if they're traveling in another country? Or?
Yes, we do recommend getting the COVID-19 vaccination, and some countries do require it to be able to enter.
Do you think there was some confusion as a result of the COVID vaccination? Because it's not really a vaccine, it's more of a shot. Don't you think? Is it?
So the COVID vaccine is a vaccine. It was just manufactured in a different process than what we tend to see our standard vaccines in. It's made from an mRNA, so it is still a vaccine. It still prevents you from getting severely sick and still mounts an immune response.
Okay. Because I guess, I think about, like I have the smallpox vaccine because I'm older, and but you never had to have it again. You just got it one time and then it was over and then it was kind of wiped out. And I think that's what a lot of us thought the COVID vaccine would do.
Yeah.
But it's not the same.
Yeah, it is. COVID, the virus itself mutates very fast.
Okay.
So they have to stay on top of how the virus mutates, which includes changing the vaccine to meet the strains.
So whereas smallpox probably just stayed the same.
Yeah, because it was eliminated in the United States.
Okay. All right. What about, are there any other things you want people to know about that they need to be aware of as far as communicable diseases in this area?
Sure. So recently, we have seen an increase in cases of tuberculosis. I know that individuals thought TB was a disease of the past. It's not. So it is very much here and present. And we've seen an increase in cases not only in Vandenberg County, but the nation as well. So TB is very much still something that should be on the forefront of all of our providers' thoughts when they're seeing an individual that has been sick for a prolonged amount of time with weight loss, night sweats, fatigue, and chest pain, also a prolonged cough. We recently did come out of a syphilis outbreak. So again, another one of those diseases that, everyone thought was a disease of the past, but then again, it is not. It has come back with a vengeance. And we're unfortunately seeing ramifications of that into our prenatal population with cases of congenital syphilis.
Really?
Yeah.
And what are symptoms of syphilis?
So it depends on the stage that the individual's in. It could start out with what we call a chancre, which is a painless sore. Then it can move to a rash on the body and hair loss, and then unfortunately can move to cognitive manifestations, and then if not treated, it could lead to death.
Oh, and that's even been in this Vandenberg County.
Correct.
Oh my goodness. All right, what if any impact will the various federal informational freezes cause in this area? I mean, or do you even know yet, and the suspensions that they've announced?
Sure. So right now, we don't know how they're going to impact us, but we're really keeping an eye on things. At the state level, there was talks about cutting the Healthy First Indiana funding that local health departments received, and that would really impact our ability to expand our services, especially to our vulnerable populations here in our community.
So you say there was talk about that. I mean, that's something from the state level, but they don't know. It's just a guess? I mean, they don't know. It's not clear.
Right. We are still waiting on the final rule from the General Assembly.
Okay. All right. Well, thank you so much for the information, and hopefully everybody will get their vaccinations.
I hope so. Thank you.
It seems like the flu and COVID have been running rampant in the area for over a month now. Here to talk to us about infections at the local level is Dr. Gus Fontenelle, a primary care physician at Deaconess. Thank you so much for joining us.
You're welcome.
So we've heard a lot about the anecdotal evidence about the flu and COVID running rampant right now. What are you seeing in the office?
Well, we have perceived that in early January, the cases were slowing down, decreasing, but now we are seeing like an increase again. And when we check the information on CDC, we see they monitor two things. Like you can see emergency department visits related to the infections, flu, COVID, and RSV, and they analyze wastewater information too. In this county, like in Vanderburgh, like they see that the emergency department visits were low, for COVID and flu, but in the wastewater, it was like for the COVID was high and for the flu was moderate. Sometimes you can have the infection, but not be that severe. That will make people look for help. And the problem is that they can keep like spreading the infection because they are not like too sick to look for help, and not doing the appropriate like measures.
And letting other people know, hey, I'm contagious or something.
Yeah.
So what are your recommendations if someone does get the flu?
For younger people with like no comorbidities, they maybe will have like just like that mild symptoms like some sneezing, coughing, and then they'll get better. But some people have to go to the hospital. So it will depend on the case. I think as these diseases can be very similar in presentation and require different care, it's really important to be in touch with your primary care doctor, and the best thing is always prevent. It's avoid the problem to happen. It's always better to avoid problems to happen than fix that in medicine in general. So getting vaccinated, it's really important. If you can, it's not too late for that. If you like contact your clinic and your primary care physician, primary care provider, and try to get vaccinated. Especially if you have signs, like very high fever and low blood pressure, you're feeling like you're passing out. That's our like red flags that maybe we need like to be in the emergency department.
Right.
But in most of the cases, you just contact your primary care provider and they will analyze if this, test you for these different diseases, like bacteria and virus, they are very different bugs, and the medications that combat these infections are different. So like if we don't know exactly what it is, can be hard to do the appropriate treatment. So it's always good to be evaluated first.
Well, in talking about preventing it, I know you mentioned the vaccinations or those shots, but I'm assuming hand washing is always top of the list as one of the ways to prevent it.
Yeah, especially like, like not just for respiratory infections, but like, like cases of like diarrhea related to virus. If you wash your hands, you should wash your hands as much as you can before eating, before like touching surfaces like that are common, like the doorknobs, for example. Like the norovirus can stay alive in a surface for like 2 weeks, up to 2 weeks. So
really?
Yeah, it's really long. So like washing hands is a good way to avoid, like if you're carrying, if you're taking care of somebody who is infected, like always wash your hands after you take care. Like a lot of people have to take care of like elderly populations
Or children.
If you change the diapers, if you change kids' diapers, you should wash your hands.
You know, when COVID was first out and we had all the recommendations, they changed all the time, you know, don't be around anybody for 10 days, et cetera. What are the current recommendations as far as COVID?
If you start to have your symptoms getting better and you don't have fever, you should be isolated for like 24 hours. Other things that change, like some patients, they will require antiviral medications. You know, viral infections, they can be self-limited, you know, that they will get better by itself. But some patients, they will benefit from antiviral medications that they contain like the virus from like multiplying in your body. So like, for example, a person who is on chemotherapy, who has cancer, like their immunity would be low. So this kind of patients, they can benefit from that. So it depends on the risk factors. We have Paxlovid, for example, that can be given like outpatient.
And that's why I was wondering how if you recommend that or when you recommend it.
Paxlovid is recommended for patients who have a higher risk of severe infection, and some factors can increase this risk, and this will be like a clinical judgment of your like primary care physician too. But I can mention some, for example, people who have more than 50 years old, especially those with more than 65, they will be higher risk. People who are not vaccinated too, people who got COVID vaccine, they will have a lower risk of having a more severe infection. People who have like some chronic diseases like COPD, for example, they're already prone to have like worse respiratory infections. So those are two. People who have immunosuppressants, like if you had a kidney transplant, lung transplant, and is taking medications that decrease your immunity, as I mentioned before, chemotherapy. So your primary care will analyze all this data and come to a conclusion, this person needs that or not.
So what about the at-home testing for COVID? Is that something you still recommend, or should they go to the doctor instead, or what?
Yeah, so CDC, like, you can find on CDC websites some FDA-approved tests. You know, they can actually work. I just think that it should not substitute like having contact with a primary care provider. I'll give an example. For example, if you're having cough, sneezing, fever, and you do this viral test and they're negative, but let's say if you have a bacterial infection, this would not appear there. So I believe this would not substitute like being evaluated. I think it's a good thing if, like, you know, increasing access to tests. I don't think it's a bad thing. And if you cannot move, especially like in a snowstorm or something, it's not bad. And it's something that can be done. It's okay. Just, I think I would not like refrain from like calling your primary and be evaluated. Right. You know, he can get a clue that, you know, they're trained to get clues that this can be a bacteria, this can be something else. This person needs an X-ray, or, you know, depending on the time frame, how this presents, how's your history.
And to your point, where you were talking earlier, it's also helpful if people are letting their doctors know, just so they have an idea of the numbers in the community, right?
Yeah, exactly.
Yeah. So what about the norovirus? I'm hearing it's more prevalent this year than usual. What is the difference with that, and are you seeing an uptick in it?
Norovirus in general has always been like the most common cause of like this, like infectious diarrhea in the U.S., like diarrhea with nausea and like foodborne related like diarrhea. So we see many outbreaks during the year, like every year. So the bottom line is like it's important to be aware and try to prevent spreading, regardless if it's like a little more or not now, you know, because it always has been like a significant cause of like diarrhea. So it's not always recommended to do the viral test, like to check the stools and see if this is the specific virus. So maybe it's hard for us to know exactly, like, you know, like how much of this diarrheas are caused by norovirus or other virus.
So what about, you mentioned that it's harder to kill on the surface. What should people be doing to try and make sure that their surfaces are clear of the illness?
Yeah, I don't see any specific recommendation for chemical substance that should be used. And like they just saying that washing your hands with soap, it should help.
Right.
That's what they recommend in general. So like, it's more that if we don't wash at all, like we'll be neglecting the risk and it will last very long.
I know, like after I go to the gas pump, for example, I always try to use a hand sanitizer, just because, and to your point, the person before me could have had it.
Yeah, that's right.
It was on the surface. So are there any other ailments that people should be mindful of right now or aware of?
Yeah, I believe like besides the COVID and flu and the RSV that we're talking, that they all cause like respiratory symptoms. And there are other viruses too that we don't check in general, but because they're mostly self-limited. Adenovirus, like parainfluenza, there are other viruses too but it's all like if you have symptoms like this, like look for care and then they will try to identify if they're the virus that needs to be identified for a specific treatment or if it's just a self-limiting infection probably. Other thing I would emphasize that some people, they go like to cruises, travel abroad, like be careful, like, travelers, diarrhea, or like, mosquito infections like dengue fever, malaria, like be aware that if you're going to a cruise or going to like abroad, like to check if there are any prophylactic recommendation from CDC or something you can do like to avoid like any infected.
Okay. All right. Well, lots of hand washing and sanitizing.
Yeah.
Thank you so much.
You're welcome.
Next, we'll be talking to state epidemiologist Eric Hawkins at Indiana Department of Health about the avian flu. Thank you so much for being here today.
Yeah, my pleasure. I'm happy to be here.
Now, tell me, what does the Indiana Department of Health do in general?
Yeah, so that's a big question. So our Indiana Department of Health we're a pretty large agency, so we cover lots of different areas of public health. Really hard for me to go through each one of those, but just to name a few to give you an idea of what our scope is. But so we cover infectious disease epidemiology, which I'm an epidemiologist, so I cover a lot of that area. We have things like lead and healthy homes, immunizations, environmental health, trauma and injury prevention, maternal child health, just to name a few. We also have our state laboratory as well. So pretty large agency, but really what our mission is to really promote, protect, and sort of improve the health of everybody in the state too, with the goal to get everybody as healthy as we can, no matter where you live, work, or play in the state. So that's sort of our mission and vision of our agency.
So we've been hearing a lot about the bird flu recently. Where do we stand with bird flu cases in Indiana?
So first, it's important to note that, you're probably hearing about avian flu or H5, you might hear it called as well. We're hearing a lot about that, but it's important to remember that the overall risk to humans is low. To the general public, it's a low risk at this time. So in Indiana specifically, we haven't actually had any human cases of avian influenza. We have seen some nationally. So if you look at some of the national numbers, there's been about 67 cases, human cases across the country, and that comes from about 10 different states. But a majority of those, or almost all of those, have had some sort of really identified close contact with animals that are known to be infected with avian flu. So that's sort of the national picture, so to speak. Indiana, we work very closely with our Indiana Board of Animal Health, also our Department of Natural Resources. They do a lot of the animal health side of things, and the Department of Health does the human side, of course. So we're working with them closely. They look at influenza maybe in poultry operations, poultry flocks, those sorts of things. So you might have heard about some of those, but we haven't had any actual cases among humans.
So I guess what happens when there are bird flu cases?
So if you look at some of the other states, when we look at what we call avian flu, it's important to note that avian flu, that term comes from influenza viruses that normally circulate amongst birds, but they can cross over, or humans can become infected if there's really close contact there. But again, going back to that risk is low. So very similar to like you would see with general influenza. If somebody got infected with the general influenza virus, you might see somebody that gets sick. They a lot of times with avian influenza, the illness is really mild too. So across the country, those human cases, there's very mild, mostly very mild symptoms. They might be fever, maybe a cough, similar to like you'd see with normal influenza virus. We've also seen across the country where it's individuals may only have pink eye or conjunctivitis as their only symptom when we're looking at avian flu specifically.
So is one of the big concerns that it's going to spread amongst like chickens or whatever, not
Sure.
so much that it's humans are going to get it and die, but the birds will get it and die?
So yeah, and we've actually seen so our Board of Animal Health, actually they have a nice website for reference for you guys too. But even going back to 2022, we've had lots of quite a bit of activity among bird flocks, so like poultry operations in the state, and not just Indiana but across the country. So it's been circulating amongst migratory birds, and then that ends up possibly getting into some of our more commercial operations around here too. So we have seen that even going back to 2022, we've seen some activity. And then if you look at some of the information coming out from Indiana Board of Animal Health now, they actually are seeing some cases among those farms now too.
But is the danger, are humans going to get it from eating eggs or chicken, or is it more from handling the eggs or the chicken?
Yeah, so there's so all the precautions and all the messaging we have around avian flu is again going back to low risk to humans, but there are occupational exposures that make people more likely to get it, and those occupational exposures are really those that are working very closely with animals that may be infected already. So they're having that close contact, actually touching, handling those types of those animals. So that being said, it's always important to fully cook our foods, whether that be chicken, eggs, beef. It's always important to make sure that we're properly cooking food, to make sure that we're making the food as safe as we can.
So even people in the agriculture industry, though, they're not going to get it. It's not airborne. It's something more that if they didn't have gloves on or something, that they would maybe get it that way. That's how it would jump to people.
Yeah, so a lot of recommendations that are coming from the national guidance too, when we're talking about those occupational exposures. So you're seeing dairy cattle that are actually becoming infected, and then where we're seeing some of the human cases are those dairy workers that actually work on those farms where there are known cases of cattle that have avian flu. So they're close contact. They may not have I guess the personal protective equipment that would be like gloves, respirators, or masks, those sorts of things. So those are some of the things that are listed that are recommended from the CDC if they're working with those animals that may be infected. So,
well, is there any concern about it passing to maybe you mentioned cows, but then to more domestic animals like dogs and cats? Or I mean, is that a concern? And then maybe it goes to people that way?
Yeah. So there's So there have been cases of domestic animals across the country too, that whether it be cats and other mammals. So that has been happening. But what we haven't seen is again that risk from transmission from animals to human has not continued to increase, so to speak. So that risk is still low. So it's really that close contact there.
So it sounds like the risk is pretty low as far as humans catching it. Is there anything else, though, you'd like everybody to know about avian flu?
Yeah. So again, I just go back to the like you just stated. So the risk of human infections is still pretty low. You're hearing a lot about it. I think public health is doing a really good job of monitoring the situation. We're looking at where the risks are, which animals across the country are becoming infected, and precautions that need to go into place. But again, even there's a low risk for humans to get it, and then there's even a much smaller risk, and it hasn't been documented at this point in the U.S. So where a person is spreading avian flu to another person, so that has not happened either. So that's why we say the risk to the general public is still low. It's hard to get from the animals, but it's also it doesn't transmit human to human very easily either. So.
All right. Well, thank you so much. That helps clear a lot of things up.
Sure.
Thanks to our guests today for talking about all of the illnesses going around our region. I'm April Nading. Thanks for watching WNIN Newsmakers.